Hello everyone, I'm Dr. Angela Mattke and you are watching Ask the Mayo Mom on Mayo Clinic's Facebook Live. Every other week I host a show where we discuss pediatric health topics with top experts from Mayo Clinic Children's Center in Rochester, Minnesota. If you're joining us for the first time, we want to hear your questions. Please post relevant questions about today's topic, which is about sports injuries in children. We will be starting today's discussion with the hot topic of concussions. And joining me is Dr. Dave Soma, who's a pediatric sports medicine specialist at Mayo Clinic Children's Center. Dr. Soma is an assistant professor of pediatrics and an expert in the evaluation and management of sports-related concussions and other injuries in children. He has worked as a team physician for many sports teams at both the high school and the collegiate level. Dr. Soma was a former high school and collegiate athlete, and we're very fortunate to have him joining us here today. Dr. Soma, thank you so much for joining us.
Thank you very much, Dr. Mattke, for having me. It should be fun.
It should be fun. I'm hoping to learn a lot about concussions today.
Awesome. Yeah.
So concussions has barely been a hot topic over the past couple of years, but I still think that there's a lot of maybe misunderstanding about what exactly a concussion is. Sometimes people think it's only when you lose consciousness or you get a head ringer or something like that. So can you really explain to us what is a concussion?
Yep, absolutely. So, the medical definition is a complex pathophysiologic process affecting the brain induced by biomechanical forces, but that's really hard to understand.
Yeah.
So more simply, I would say it's a form of a mild brain injury. It results in an impairment of function, and then after there's an impairment of function, it's going to manifest with various signs or symptoms. Like you said, 90% of concussions do not involve loss of consciousness. So the majority of the time they will not have that, which is kind of an obvious sign. And the other things that can be known is that it usually has normal imaging. So people that have a concussion, if you do an MRI, a CT, an X-ray, those are going to be normal. So you really have to use your history to get a really detailed story of what happened. And then after that, really do a good exam to determine if there's any signs of impairment. And then if you come to the conclusion that those signs and symptoms cannot be explained by anything else, then it's probably a sign of a concussion.
Okay. Do they have to have certain signs and symptoms that are required before you make that diagnosis?
Not specifically. Every concussion is different, so it's not like everybody's going to have a headache or everyone's going to have nausea or everyone's going to have memory loss. I think it's somewhat variable, but the most common symptoms would probably be headache is about 90+% of concussions. Just not feeling right, so having just feeling off or being maybe slightly slowed or confused is probably the next most common one. But again, I think every patient is different, and so you got to really approach one each differently.
Okay. So you made the diagnosis. Who's making that diagnosis, and where are they going to be going for treatment?
Yeah, so it's a state law, actually. All 50 states require that coaches receive some education in some capacity to kind of understand concussions, and specifically in Minnesota, there's courses available to coaches. And so oftentimes the first person on the front line might be a parent or a coach. And so having some basic understanding of the signs and symptoms might give you a clue, like maybe I should pull that person out of the sport or the game to have them come out. And then once they're out, if you're at a higher level, you might have the luxury of having an athletic trainer, or maybe there's a physician on the sideline or somebody that would help make that diagnosis. And then once you've made that diagnosis, you have to decide what's the next step. Where do you need to go? Do you need to go to the clinic or to the ER? Very few concussions actually require emergency department visits. There are some things that would make you say maybe you should go there. If you have recurrent vomiting, prolonged loss of consciousness, the worst headache of your life, your child's extremely drowsy, things like that might be clues. I should probably go to the ER. Right. But otherwise, I think that it's probably safe to have them evaluated very quick, relatively promptly in the clinic.
Okay. So we were talking earlier, the coaches on the sidelines are often making this diagnosis. Yeah. And a question brought up by a coach said, how do you really get the children to actually disclose what they're feeling? Because sometimes there can be the hesitancy of the athlete of not wanting to miss and they want to go back into the game. Yeah. How do you build that rapport, and how do you really make sure that you're getting the kids who have concussions out?
Yeah, this is a tough thing because every kid wants to keep on playing, and every coach wants their best players to keep on playing. So how do you really negotiate that? I think that the best thing as a parent or a coach or a physician that's covering the game is to keep your eyes in the game. So there are times where it can be pretty obvious. You're going to see a kid who stumbles off the field, or they're unconscious briefly, or they kind of shake the cobwebs out of their head, things like that. That might give you a clue that there's probably something going on. But not every big hit is a concussion. So if you see a big hit and you're questioning it, I think the best way to do is, get the kid when he's off the stand and say, hey, I just want to make sure you're okay. Make sure that you have some sort of rapport. Try not to make them too intimidated. Many kids are going to come off and go, I'm fine, I'm fine, I'm fine, I'm fine, which is okay. But I think, really just kind of getting an idea of how they're doing. In the younger levels, I know that even me as a coach and a parent, I want my kid to play. But in the youth levels, there's really
Right.
no reason to send them back. I think if you're in 2nd grade, 5th grade, 6th grade, and you suspect a concussion, just take them out. There's no reason to get them back out there too soon. Bad things can happen. In the high school levels or the college levels where the stakes are a little bit higher, oftentimes those athletes are going to have some sort of baseline test. So they're going to have some information on how their balance is, or how their processing speed is, or how their baseline symptoms are. And so what you can do in that situation is take maybe 5, 10, 15 minutes depending upon, and do an evaluation and compare them to their baseline. If anything is significantly different from their baseline, then that would be a potential sign of a concussion, and you'd want to get them taken out. And I think the general motto is, when in doubt, keep them out.
Right.
But at the same time, I don't think every single hit to the head obviously requires a player to be out. By the end of a football or a soccer game, you wouldn't have anybody left if every time it happened.
Right.
So, yeah.
Right. So what is this baseline testing that you were talking about, and who needs it?
So not everybody needs baseline testing. I think that baseline testing, the purpose of it is so that if somebody does get hit in the head, you can compare and determine if there's an impairment. The other thing that you can do too is that you can actually hope that they return back to their baseline before you get them out in the field to play again. You want to make sure that everyone's back to their normal self before they get back out there. There's a lot of different baseline tests out there. Sometimes there's simple things like questions. You ask them some questions about orientation, where are they? Have them do some basic math skills, have them do some basic memory skills, and see where they're at. There are more expensive ones where you do computerized testing. There are ones where you can do a test, assess their balance. There's also some ones that Mayo is in conjunction with called the King-Devic test, which is some cards that kids will read, and you time them on an iPad or a card to determine how fast they process and how well their eyes can track. And again, these are all things out there, but one of the best baselines is knowing the athlete. So having an idea, having a parent or a coach who knows them well, try to determine, is he acting funny? Is there something different about him? As those things would probably be just as important as any specific test.
Okay, so something that's going to be different from what their baseline processing speed was in these tests is going to suggest that there could be something underlying in their physiological processing of their brain, right?
Yeah, absolutely. So yeah, if they're normally able to read a card or do something at a certain speed or ability, and it's decreased, that could potentially be a sign.
Now, are certain athletes at the high school level being required to do all these testings now? Okay.
Yep, absolutely. So locally here in Rochester, we have all the major high schools that we provide athletic training services to, specifically football, soccer, hockey, wrestling, some of the high-risk sports. We require all the athletes to have baseline testing before they go into the season. In the youth levels, obviously that's much more difficult to accomplish, so we're not necessarily requiring it, but I do think that as you go up in levels, it's much more common. Very common in the collegiate and the professional athletes at all levels to essentially, get some sort of baseline test.
And if you have a child who's maybe participating in some of these sports and it's not being required by your school or by your youth sports league, is this something parents can pursue on their own?
Depends upon the community. So sometimes parents can pursue this. I don't want people to feel that you absolutely have to have these things. The tricky part in children is that if you get a baseline at the beginning of their 2nd grade year or 3rd grade year, they're dramatically different halfway through and at the end of that year. So those relying baselines may change over time. And the other thing too is a lot of times their symptoms are going to overlap with their testing. So if a patient is being honest with you and they're telling you that I'm struggling in school or that I'm having headaches, that probably can replace a lot of the baseline or those tests to compare to. So I think it's a nice thing to have. It provides something a little bit more objective, but I wouldn't say it's mandatory at all. And again, I think that in those younger populations, if you want to pursue it, I think talk to your provider.
Okay. We have an audience question here, and I think this is going to help clarify a really important point. So it says, at what point do you need to have a CT scan to confirm a concussion? And I think you touched on this earlier.
Yeah, absolutely. So a CT is not done to confirm a concussion. A CT is done to look for something more concerning. So something more concerning would be a fracture of the skull, a bleed inside the brain, or some other type of major intracranial injury. There can sometimes be associated injuries too, so like neck injuries, oftentimes with whiplash, there can be injuries of those. So if you're going to do a CT scan, you're not doing it because you think the patient has a concussion, you're doing it because you think they have something worse.
Right.
And again, some of those signs that you would be looking for would be recurrent vomiting, really significantly sleepy, unarousable, maybe the worst headache of their life, some of those types of symptoms. The other thing is the mechanism. So if the person gets hit in the head with a metal bat and they're not having a helmet on, they get hit by a car. Those types of really powerful mechanisms, those might be things where you'd say, boy, I'm a little bit more concerned because they got hit in a certain area and that would be that.
Yeah. The hard thing with concussions is there's not a test where it's a yes/no answer that tells us right away. So it's really this conjunction of symptoms, knowing the kid, having them give us feedback on what they're feeling.
Yep, absolutely. We're trying to do some research. There might be, in the future, there might be opportunities to do blood testing or certain imaging studies or other things to really determine if you have a concussion. But right now, we're really relying on a good history, a good exam, and use of the tools we have.
Okay. So you've diagnosed a kid with a concussion. How can we help their concussion heal and their brain start to get back to its normal functioning?
Yeah, this is a great question. So back when I used to play sports in high school, and when you played sports in high school, you get bonked in the head. You say, "Oh, you've got your bell rung," and you go back out there. So I would play the same game the next day. I'd take an ACT test the very next day. There was no real the education wasn't there. We didn't know what was really going on.
Right.
And then I think we started in maybe the early 2000s to really realize, oh my gosh, this is not good to have all these concussions. So then the pendulum swung really far the other way. And we were saying, okay, go to your room, sit in the dark, don't do anything. And we found that actually created problems too.
Right.
So now the pendulum's kind of working their way back more towards the middle, where we're kind of typically saying that first day or two after a concussion, you really want to focus on rest. So make sure you're getting adequate sleep, staying hydrated, take care of your body, manage your symptoms. But after a day or two, most of the time these kids, they can get back to school in some capacity, maybe not taking tests, but doing something. They might even be able to do some very light, low-intensity exercise. You might have them go for a walk. You might have them just get some fresh air and do some chores around the house, things like that. And then as their symptoms improve, you gradually have them do more. The two rules I usually tell people after a concussion is, one, don't do anything that hits your head again. We don't want to make something worse. And then the second thing is, don't do things that make you feel worse.
Right.
So if you're looking at a computer screen and it makes you feel worse, don't do it. If you're in a loud noise in the cafeteria and that makes you feel worse, don't do it. So I think if you follow those rules after a day or two of rest and you just kind of let your body do most of the healing, most of the time kids do pretty well.
How long do you expect the symptoms of a concussion to last?
That's variable. Older research would probably say the average recovery time is 80 to 90% of people will recover within 7 to 14 days.
Okay.
Probably in children, it can be a little bit longer. So I would say that most kids are going to recover somewhere between the 1 and 4 week mark. So I think that's kind of a good window. If it's getting to be symptoms are not getting any better in the first few weeks, or they're still symptomatic at 4 weeks, you might want to enlist the experience of somebody with a lot of experience or skill with this.
Okay. So during this prolonged period where they're recovering, is it absolutely no sports, no exercise, or is there kind of a graded return to play?
Yeah, great question. So that's actually a point of change right now in the sports medicine community. So we used to say that you could probably do basic daily activities, but they didn't want you really resuming any significant activity until you're asymptomatic and back at your normal self. And then each day you would progressively increase your activity, going through, ultimately 6 levels, with a 6th level be playing in a game, and level 1 is basically resting. And so you gradually introduce more. More recent research is actually showing that some low intensity exercise that does not provoke symptoms early on may actually be safe and beneficial. And so I think that you should always talk with your provider in making that decision, but I think that there is some more recent evidence that a little bit of activity may actually be beneficial.
Right. What would be an example of that?
I think going for a jog, getting on a stationary bike, if you're really in a controlled setting, maybe even getting in a pool and doing some light swimming. I think the big thing would be avoiding significant straining or really close to maximum intensity exercise.
Okay. Do certain sports have a higher risk of concussion?
Yeah.
I mean, some of them really kind of take a lot of heat for this.
Yeah, I mean, football is the one that gets the most attention, but believe it or not, depending upon which study you look at, there are some other sports that are very close in their concussion rates. So the ones that probably are the highest risk for boys would probably be football, wrestling, hockey. Soccer is not too far behind. Lacrosse is actually fairly high as well. But really no male sport is immune from concussions. I've seen it in golfers. I've seen it in tennis players. In the female side of things, they obviously don't have football, and some of the sports are a little different, but soccer has got a fairly high rate. Girls hockey, girls basketball, girls lacrosse, there are some other ones that have a fairly significant concussion rate as well. So I think, again, there are ones that are higher risk, but I've had kids getting concussions virtually doing anything.
Okay. Are the concussion rates different between boys and girls?
So there is some data that shows when you look at sports that are very similar, for example, soccer. Boys and girls soccer is very similar in regards to the rules and the equipment and things like that. They actually have shown that girls are maybe as high as twice the concussion rate than boys. And the natural question is, well, why?
Why, yeah.
And so what I would say is that there's a lot of theories. There's nothing that's been proven.
Okay.
One thing is that we think is that neck musculature helps to kind of support the head. So you can imagine if a ball's coming at you and you can better brace for that impact. If you've got stronger neck muscles, they're going to be less kind of like jarring. And there's some evidence that men may have stronger neck muscles. Another thing is that hormones could be playing a role. And then the other thing that has been brought up is, are women or men are men more likely to hide their symptoms? Are women more likely to be honest with their symptoms or bring forth things? So maybe it's underreported in a certain population or overreported in another.
Right.
But I think that most of the data would show that there's a little bit higher rate in the females.
A question that I get asked, and I'm sure you've been asked many times, is would you let your sons play football? We both have sons. And so what would your answer be to that?
Yeah, so I'm biased. So I played football in high school and college, and so I played football for many years. I've had many concussions, so I've had probably 6, 8, 10, and I jokingly say that maybe if I had less, I could be a neurosurgeon. But seriously, I don't think I'm too weird or too odd, and I've been able to do, I think, pretty good things. And so I don't have headaches. I don't have any memory problems. I've been able to do quite well. But I'm biased. I found that football was extremely beneficial for me. I think it taught me wonderful life skills. I have great friends that I played football with. There's a lot of things that I'm doing. That being said, I'm not going to force my kids to play football. I'm not going to tell them that they shouldn't play football. I think it's really a decision for every parent to make on their own. I think that football is a great sport. It's one that usually is done primarily in the fall. It's not a year-round sport. It takes people from all shapes and sizes. Most football teams do not cut individuals. They'll let anyone be on the team as willing to try and show up. So I think that's one thing that's really great. Obviously, there's risk of injury in football, which is concerning. So I think that you should really, if your child is interested in playing, you think they're developmentally appropriate, and they're going to play safely, I think it's very reasonable to consider doing it. But I realize it's a decision for every family. But if my 3 boys want to say they want to play football, I'm absolutely going to let them do that.
Absolutely. Are there what are some of the things that they have been doing with, especially some of these youth sports leagues, to try and minimize the risk of concussions?
So there's been a lot of different rules. For soccer, for example, they've tried to minimize the amount of heading. So younger leagues are not allowing heading because very few goals are going to come in heading at the younger ages, and it's probably a way to minimize some of the head impacts. In hockey, they have rules about kind of areas around the edges of the ice where they avoid checking, and you have to kind of keep your heads up near the boards and things like that. There's also fair play rules in hockey locally that if your team is playing dirty or making cheap shots, that can actually affect your record and your placement in the conference. So it's trying to create some more safety. In football, they've made a lot of measures. So 30, 40, 50 years ago, there was spear tackling where people would lead with their head. Those have been banned. Kind of those blind shots in the NFL or things like that, those are actually being penalized now. There are, there's constantly improving technology looking for, cameras looking at the fields to look for signs of concussion and things like that. There's rule changes. So there's a lot of times changing the kickoffs or kind of which is a common play where concussions can occur. They've made some rule changes there. So there's a lot of things that we're doing to try to make sports even safer than they previously were. I can speak personally from my example. So I played football in high school and college, and I played for a terrific coach in college. His name was John Gallardi at St. John's, and he was really a pioneer in my opinion. He kind of used common sense to make decisions in sports, and so he really didn't believe in tackling or hitting significantly in practice. He said, why would you get hit in practice and injure yourself when the purpose is to win games? And so I had probably, 6, 8, 10 concussions at least during my high school years and below. I had 0 in any practice or any game in college because I think it was saying, you know what, we can still learn the basics of football. We can still get in position. We can still, get ready without actually having to make those big hits all the time. And so I think we're realizing that there are rules that are being applied to certain sports that are higher risk to try to make them safer, and you can still have great outcomes. We had a very successful team when I was playing and was very fortunate to be on some really successful teams.
Absolutely. Are they starting to implement the no tackle rules in youth sports, in high school sports, in collegiate sports?
In the practices?
Yeah, in the practices.
Yeah, so they've made some rules for 2 reasons, not only for concussions, but also even for heat, illness, and other things, where the first week of practice, they're not letting them use pads as much to try to get them more accustomed to things and get their body ready. And then they're trying to minimize, I think, the number of contact practices during the week as well. So they are making some changes at the collegiate and high school level to try to minimize some of those things.
Okay. What about when it comes to the equipment that we're using in sports? Has there been anything that you can do to help prevent concussions?
Yeah, so there's constantly efforts to try to improve the technology, and I think that that's maybe in the future. But right now, I would say that if you think about which sports have concussions, football, they wear helmets.
Yeah.
Hockey, they wear helmets.
Right.
Soccer, they don't. But again, there are a lot of sports that have protective equipment that people still have concussions. So helmets were not designed to prevent concussions. They were actually designed to prevent against those more severe injuries, fractures, bleeds, and they do great at that. They have made a huge difference in those severe injuries in sports that is what they were designed to do. Right. But there are things out there where they have mouth guards or they have header bands or certain things that they're promoting as things that will help protect against concussion. And probably at this point, there really isn't enough evidence to say that those are things that I would strongly recommend people invest lots of money into. In the future, that might change. But right now, I would say playing safe, using good form, and other things are probably more important than any specific device that you can wear.
Okay. In the news, there's this week there's been a lot of talk about CTE.
Yeah.
And about how the incidence of it in professional football players. Can you talk a little bit about that study?
Yeah, absolutely. So let me create a background of what CTE is.
Yes.
So CTE is chronic traumatic encephalopathy. It's been described probably over the past, at least 5 to 10 years. There's been a movie about it called Concussion that came out, I think, a couple years ago, starring Will Smith. And so there's been a lot of media attention about this CTE. What CTE is ultimately it's a pathologic diagnosis. So something that you will diagnose after someone dies. They'll do an autopsy on their brain. They'll do special stains, and they'll look for a deposition of protein in certain areas of the brain. If they find it, then they're trying to decide what does that mean. The most recent study that was published in the past week or two came out of JAMA, which is a well-known medical journal, and they showed that 99% of NFL football players had signs of CTE on their autopsies. That study, albeit I think is a great study to increase awareness and provide information, there are some things that we should think about. So these are people that donated their brains to science. So there's obviously a little bit of bias there because these are people that had problems that donated their brains to try to determine, I think, is there an explanation? And maybe CTE, which was found in 99% of those brains, could be the cause. And the other thing too is, but we don't really know how the pathologic findings, so the findings in the autopsy, manifest themselves clinically.
Right.
So there may be individuals who have signs of CTE on their brain that may have no signs or symptoms, and there may be other people that have similar signs and symptoms that do not have signs of CTE. So I think the real, there is a connection between, I think, head trauma and CTE, but where CTE, what does that cause to them when they're living is, I think, still something we need to decide. I think that it's really important to investigate this, and common sense would really say getting hit in the head over and over again is probably not a good thing. Right. But at the same time, I think being sedentary, not being involved in sports and doing other things is probably not a good thing either. So I think we really have more information to gain. But that study, I think, was just showing that, yes, people that play football are more inclined to see those changes in the brain, and how they manifest, we still have to try to figure out.
Okay. Before we move on from concussions, because I think, sports gets sometimes a negative, sports participation gets this negative image with parents and stuff like that because of all the concerns with injuries. But what are some of the benefits of sports participation? You mentioned that you learned a lot from football.
Yeah, and I think that a lot of parents are, I think, nervous to have their kids participate in sport, but there are many, many studies out there looking at the benefits of sports as compared to non-athletes, but also compared to people that just do recreational exercise. So just having your kid go for a bike ride or run does not substitute for sports. There are emotional benefits. So kids have lower rates of depression, lower rates of suicide, lower rates of many of these types of things. They have increased social skills. So most kids that play sports have better teamwork, they're better team players, they make lifelong friends, they have a lot of those attributes. Successfully in general, they have shown many studies that kids who play high school sports are typically more likely to go to college. They're more likely to be successful in their careers. They're going to end up making more money typically later on in life. And generally, these kids are just very well-adjusted people. Personally, I feel like, when you go through 2-a-day football practice in the middle of the summer and you have to push through, significant conditions, or, you're playing the fourth quarter of a basketball game and you're really tired and you have to push through that last little bit to get through it. It teaches that perseverance and some of those things that, kind of those resiliency that I think a lot of times kids may be lacking these days, and I think that's something that really can be of value.
Absolutely. Well, let's move on to talking a little bit more about other sports and other sports injuries. What advice would you give to a parent who's starting to focus their child on one specific sport because they have dreams of them getting a full ride collegiate scholarship?
Yeah, what you're, I think, describing is sports specialization.
Yeah, absolutely.
And I think that sports specialization, I think intuitive to the parent, your intentions are good, right? You see a kid at a young age that's doing well in a sport, and you want to continue that success, maybe for high school success, college success, professional success, or you just want the kid to have positive feelings. So the intent is to think, well, maybe if I have him do more of this, then I'm going to result with, better outcomes in the end. The tricky part about that is that it doesn't always result in what you think it would be. There's been some studies that show that if you specialize, that you're actually less likely to be successful in many sports than if you do multiple. And the other thing too is the risk of injury goes up. So if you play baseball and you're a pitcher and you start pitching in second grade and you're throwing constantly, you're throwing hundreds and hundreds and hundreds, maybe even thousands of pitches every year, you can imagine that's going to do some wear and tear on your shoulder or your elbow or whatever it might be. So I think realizing that the intentions are good, but really what I would promote is sports diversity early on, and then sports specialization late in life, high school or beyond. And the reason why also is that just because the child may be really good at football or basketball or baseball or soccer or tennis at age 7 or 8, they might be completely better at a sport when they're older after they've gone through puberty. So the more you can diversify them too early, the better opportunity they have to be exposed to many things. And then when you decide what things that they enjoy or what things they're best at, you can really make that decision later. I think on top of it, there's an advantage of just having other skill sets. So, a soccer player's really got great footwork. So imagine if you played soccer and basketball, how that footwork could really translate well to basketball when you're playing defense. Or if you're a wrestler and you want to have good ability to take somebody down or do something that could really relate well to football if you're trying to make a tackle. And so a lot of times the skills you gain in another sport can make you an even better athlete in another.
Absolutely. What about, what can parents do to really safeguard some injuries and overuse injuries that we see in kids that are doing a lot of sports year round?
Yep. And I would promote kids that be active all the time. So I think that one thing that parents can do is promote unstructured play. I think that a lot of times parents have a tendency is, I'm going to sign them up for 20 different leagues and 20 different things, and then they're constantly organized, but that's really a structured thing. And I think that, again, we want to get them to do some more unstructured play. There's some studies that say that if you do equal or more amounts of unstructured play, which would be like having kids in the neighborhood take some balls and do stuff and create their own games, that actually decreases the risk of injury, whereas if it's all structured.
Okay.
And so I'd encourage that. Another rule or kind of thing to kind of keep in mind is that rest periods. Rest is really important for people to recover. So I would never advocate that anyone do more than 8 months of any single sport per year.
Okay.
So if you're a gymnast, that's very common to have gymnasts play year round. Build in at least a month here and there, or maybe a couple months in consecutive to build some time for recovery.
Right.
You could do other sports at that time. If you wanted to do softball or something else, that'd be fine. But I think giving your body a rest from the rigors of that specific sport for at least 3 to 4 months a year. Building in 1 to 2 days of rest per year. Or per week, sorry. 1 to 2 days of rest per week. So maybe take Sundays off, take Mondays off. Pick a day or two each week where you don't do structured sports. Allow your body to recover, do something else and mix it up. And then another kind of neat rule that's been shown in some studies to be valuable is don't let any kid play more hours of sports, of a specific sport, than their years in age. So, for example, if you are 10 years old, you shouldn't probably be doing more than 10 hours a week of baseball. Or a gymnast, you shouldn't be, if you're 16, maybe no more than 16 or 18 hours of gymnastics per week. We think that, younger children's bodies maybe, not able to withhold that amount of stress. And so I think kind of those mottos of taking some break during the year, taking some breaks during the week, and minimizing the total volume per week that your child's doing, I think is good ways to prevent injury.
Okay. Some parents will ask me about weight training. Does this prevent injury? And what age can they start doing this safely?
Yeah, I think that there's a misconception out there actually that weight training will stunt their growth. That's probably not the case. Kids can safely weight train even before they go through puberty and have their growth spurt. I think the thing that I would focus in on for weight training is that before a child goes through puberty and they're getting those hormones and things, they're not able to develop that kind of bodybuilder look. They're not going to have that testosterone or other things to really develop that really strong muscles. But they can still improve their muscle coordination and their form and other things pre-puberty. So I would say that when a kid is interested, maybe 10, 11, 12, whatever it might be, if they're interested in doing some weightlifting, that would be fine to do. I would encourage them to do it with somebody who knows what they're doing so they can teach them proper techniques so when they do try to increase weight later on, they know what they're doing. And then trying to do more high repetitions and not try to maxing out their weight. You're not going to gain significant strength gains in the younger children. Once you've gone through puberty, then I think it's time to start maybe trying to push and try to advance your weightlifting skills, because weightlifting is an important part of higher level athletics.
Absolutely. Between boys and girls, are there does their gender place them at higher risk for certain types of injuries?
So I think that almost all injuries that you see in a guy, you can also see in a girl. But there are some things that are higher risk in girls than boys. One common one that gets a lot of media attention is ACL tears. So I think ACL tears, almost everybody can think of a famous person in some sport that's had an ACL tear. So that ACL tear is a ligament tear in the knee. It is more prominent in girls, specifically girls involved in cutting and pivoting sports. So basketball, soccer, the rates are 5-10 times as high in the females as it is sometimes even in the male counterparts. There are programs that exist that are ACL or other types of prevention programs that kids can have. There are other things that are more common in girls. Sometimes stress fractures can be certainly more common in girls, especially if there's not an adequate nutritional need being met. And then also certain sports, girls are more likely to play gymnastics or girls are more likely to do certain sports. So there's obviously certain sports have certain more common injuries. And so there's a little bit of a tendency to have injuries based off of that.
Okay. Parents, well, let's talk just real briefly about nutrition and supplements and stuff like that. I'm sure this is a question you hear a lot. Are supplements safe for youth with developing bodies and developing brains?
Yeah, so I think that the tricky part about supplements is that many of them are not regulated by the Food and Drug Administration.
Right.
So when you go to the store and you buy a supplement off the shelf, you'd like to think what's on the label is what's in there, but you don't always know for sure. You could think you're buying protein powder and you could find out there's something else in there that was not intended to be in there. So and how much actually is in there is also hard to know. I would say that there are potential that certain supplements may be of value, but I think at the younger level, you're much better served optimizing other things. They've shown that if you get adequate sleep, adequate hydration, and adequate general nutrition, that probably supersedes any value of any specific nutrition. So when I see a kid in clinic and they say, hey doc, I want to take some protein powder, the first thing I ask them is, how many hours did you sleep last night? How much water have you been drinking? And what have you been eating? Because if they aren't doing those things first, then there's really no reason to do supplements. If they're mastering all those other areas, they're a high-level athlete and they want to talk about it, then it might be worthwhile to consider doing other things. Probably the most common ones that have been shown to do any value is maybe a little bit of protein because it helps with muscle building. Creatine's a popular one. Again, the benefits are probably very limited to a short burst of energy during certain times. And there's some other ones out there as well. But I think that I would say that speak with coaches, trainers. There are websites available out there where the NCAA will test some of these labeled substances to make sure that they're more pure. But I think, again, I would say it's an individual basis, but optimize other areas first. So getting, drinking chocolate milk, getting good protein in other ways, doing things like that can be also of significant value. Okay.
Last question that I have for you is, some kids have certain medical conditions that maybe would be a contraindication for them to be able to participate. What would you say to kids who maybe couldn't do contact sports and stuff like that? Is there other sports they can pursue? Is that beneficial for them?
I think sports, I'm biased. I love sports. I think that they're great. I think that almost every kid I can think of can be involved in some sort of sport or activity. There are Special Olympics. There are Paralympics. There's a lot of different clubs or groups where people, even with significant health concerns, can find their way to be active. Even if you're in part of like a team manager. So I know that there's a lot of times kids that can't play sports for whatever reason, but being a part of that team environment still can provide a lot of value. There are conditions, heart conditions, musculoskeletal conditions. There are neurologic conditions that might impair you to play specific sports. But I think in general, I would encourage anyone to work with their subspecialist, their doctor that's providing the care, or their primary care provider to determine what sports are safe and not safe. And there's very few conditions I can even think of where there would be you're not allowed to play any specific sport.
Absolutely, and there's adaptive sports leagues, even for young youth sports, in their communities that they can look into. So
absolutely.
Well, it was wonderful having you here today. Thank you everyone for joining us. That's all the time we have. Please join us for our next Ask the Mayo Mom in 2 weeks, which is on August 10th at 11 a.m. Central Standard Time. Dr. Dean Potter, who's a pediatric surgeon, will be joining me to discuss specific surgical treatments for children with inflammatory bowel disease. So please send your questions to us in advance so we're sure to get to them during the live broadcast. We hope to hear from you. Thanks everyone for joining us today, and have a great rest of your day.